Good morning, everybody. This is Liz Choate, registered dietitian and director of clinical nutrition here at Jackson Purchase Medical Center. And I'm doing another Learning with Liz lesson today. And today I'm going to kind of shift gears just a little bit and talk about a subject that I wouldn't say it's a touchy subject, but it could be with somebody, and talk about eating disorders. I'm going to kind of give you the definition of some different type of eating disorders, some statistics about eating disorders, because this is something that a lot of people may be touched with this. So an eating disorder is like well, I'm going to tell you 3 different ones that are out there, but there's more than that. But there's 3 main types of an eating disorder: anorexia nervosa, or I might just call that anorexia; bulimia nervosa, or bulimia, and then binge eating disorder also. There's also one that might involve exercise. So somebody could be anorexic and overdoing exercise. So like I said, there's a lot of different types of eating disorders that are out there. So the first one I'm going to kind of give you a definition on is anorexia nervosa. And what this involves is a severe restriction of calories. There's also maybe the fear of weight gain. They give strict rules to themselves about eating. And it's just with anorexia, most of the time when a person has that, they may look in that mirror and see that they're a very, very large person, but there actually could be a very, very thin person. Bulimia involves a lot of those same fears about restrictions, but it also involves a lack of control when binge eating. So what a person does is they may go and eat 5,000 calories, and then they want to turn around and they want to purge, or they make themselves vomit. That's not a nice topic to talk about, but that is what bulimia is. It also could be using excessive amount of laxatives also, and as well as the exercising just crazy amount of time. And then some people have just a binge eating disorder, and that is that they just eat an excessive amount of calories, and then they might not eat for several hours or even for a day. They don't do the purge part, but they do the binge eating with that. So here's just some statistics, and this is just crazy. I'm going to kind of read some of these to you. Eating disorders affect at least 9% of the population worldwide. Okay. 9% of the U.S. population, or 28.8 million Americans, will have an eating disorder in their lifetime. Think about that, 28.8 million Americans. Less than 6% of people with eating disorders are medically diagnosed as underweight. 28 to 74% of risk for eating disorders is through genetic, they're inherited. So a lot of times there may be a mother that she exhibits anorexia and maybe have young children, and young children sees that going on, and so they kind of want to mimic what their parent may have done. Eating disorders are among the deadliest mental illness, second only to opioid overdose. Isn't that crazy? So 10,200 deaths each year are direct results of an eating disorder. That's 1 death every 52 minutes. Think about that. I know when I work with a patient who has an eating disorder, whether or not it's anorexia or bulimia, I'm very, very truthful with those patients, and I tell them, I say, what's the very end result if you keep doing this to yourself? And they're like, well, no, I don't know what. I said, what's the very end result? You could die from this. And sometimes that really opens up, especially like a teenager's eye of oh, this could kill me. And I'm like, yeah, it could kill you. About 26% of people with eating disorders actually attempt suicide. And the economic cost of eating disorders is $64.7 billion every year. So it's kind of crazy, some of those statistics. That's a lot of people think, oh, it's not very common. I'm like, yes, it actually is common. So when somebody has anorexia, here's some of the common symptoms that they might show. They may have a very dramatic weight loss and refuse to maintain a body weight that is healthier for them. They wear very baggy clothes. to kind of hide their body shape. They're very, very, very preoccupied with their weight, exercise, and or calories. I had a patient one time who she weighed herself about 5 or 6 times a day. It was an adult, so she would weigh herself in the morning. She'd go out and run five miles before work. She would go to work, and then at lunch, she would go and run 5 more miles. So there is that anorexia and that exercise combination there. And she just, thank goodness finally she got help with it, but she just couldn't realize what she was doing. Food restriction and avoidance. Belief life will be better if weight is lost. They isolate themselves, a lot of them do. They have food rituals and secretive eating patterns. They may dispose of food in just weird places, just really secretive places. Hair loss, sunken eyes, pale skin. They can be very dizzy, have headaches. A lot of times they have very low self-esteem. They really, really do. They think if they'll lose weight, that more people will think better about them. They may have very low blood pressure. With a female, they may have the loss of menstrual cycle because their body fat becomes too low for that. They may have chronic constipation, mood swings, anxiety. There's a lot of things that goes on with that patient who has anorexia. Bulimia, here are some of the signs and symptoms. Again, some of the same stuff as anorexia, but this may be some other things. Bruised or calloused knuckles, bloodshot eyes, light bruising around the eyes. The reason why they might have a bruised knuckle is because when they force themselves to throw up, this is kind of gross, they kind of gag themselves, and their teeth can cause bruising on their knuckles. A sore throat or swollen glands, the binging and the purging. A lot of them may even have hearing loss because some of the fluid, when it comes up, can go into the tubes into the ears and cause hearing loss. Kind of crazy, isn't it? The big thing with people who have bulimia, you notice that they'll eat and then they immediately go to the bathroom. And usually they're going to the bathroom to purge is what they're doing. So, it just can affect a person in so many different ways, can affect their health-wise. It can affect their organs. It can affect, just everything like I was describing. So, and like I said, an end result can be death if a person does not get help for that. So if you know someone who kind of, has some of these traits that they do, please, please, please talk to them. To treat or successfully treat, I guess I would say, someone who has an eating disorder, it has to be a group effort. It has to be the medical doctor. It needs to be a registered dietitian, and it also needs to be a psychologist, because the mental health on that part is the huge part that plays with this, because they have to help that person understand why they are doing that and help them to get through that mark. It's not something instantly you can get over. It's something that can last for years and years and years. I know one thing I had one physician tell me one time that he says, Liz, when somebody develops an eating disorder, they always have an eating disorder. And I said, that's true. They always have it, but they can conquer it and get past the thoughts that they might have when they might want to be super, super thin, and try to do that with not eating wise. So if you know anybody who exhibits anything like this, if you know, say, a teenager who has a friend who is exhibiting that, please, please, please encourage them to get help for that, because like I said, it can kill a person. There are several, several different things that you can look at on the internet. I was looking at some things through the Academy of Nutrition and Dietetics. Also, I was looking at the website from the National Association of Anorexia Nervosa and Associated Disorders, and that's where I got a lot of these statistics from. And we'll try to kind of connect that onto this talk, just so people see that, But like I said, I can't emphasize it enough to get help if you know somebody who's having an issue with it. So, if anybody has any other topics that you would like for us to discuss, please kind of drop us a line here on our Facebook site. We'd be glad to talk about that. And like I said, this is kind of a touchy subject, but it really needs to be out there in front of the kids, in front of adults. This can happen to a females or males. It's not just a female thing. This can happen to somebody who's in third grade. This can happen to somebody who's in high school, college. It can happen to somebody who's 50 years old. So it's you know, it goes through the whole spectrum of with the life cycle of who could have some type of eating disorder. But get help out there if you need some help, okay? So I hope everybody has a great day. I hope you learned just a little things about some eating disorders from this topic today. But like I said, if you have any subject that you would like for us to talk about, please just drop us a line. So I hope everyone has a great day.